Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for epilepsy. What is epilepsy? Epilepsy is a chronic disease of central nervous system, CNS, where brain works unnaturally to create spasms of limbs, body parts, altered sensation or loss of consciousness. If there is no history of spasm for 2 occasions without any cause, the disease cannot be called epilepsy. Spasms are of different types. Some uses to stare vacantly for few seconds, others may throw hands and legs over and over, and in mouth there is foamy frothing. What are the signs of epilepsy? Number 1, transitory stupidity. Number 2, fixed look for few seconds. Number 3, fall down unconsciously. Number 4, uncontrolled convulsion of limbs. Number 5, froth in mouth. Number 6, mentally afraid, anxious and panicked. Some relevant images have been shown. Of this, most important is this picture, because this is the picture where you can differentiate epileptic brain from a normal brain, and this is possible only through magnetic resonance imaging of brain. MRI is a very latest and deep, clear-cut pictures of the disease. It shows MRI. Even MRI can differentiate parts of a dead person with a live person. MRI can differentiate. This image is from dead person, this image is from live person. So sensitive this. What are the types of epilepsy? Depending on abnormal functioning of the brain, scientists classify epilepsy in 2 classes: focal seizure, generalized seizure. When a small part of brain functions abnormally, focal seizure occurs. It has 2 parts. Loss of consciousness, either patient lost consciousness or consciousness alters, that is fixed look for few seconds, or they perform a job repeatedly, unmindfully, such as rubbing hands, chewing something, swallowing over and over. B, with consciousness, patient do not faint, but their listening, viewing, feeling, taste alter. With this, there may be involuntary spasms of limb, tingling sensation in a part of the body, vertigo, seeing sparkles of light before eyes. This picture is important. This picture. This is the picture actually. This type, mid types of seizure. Look at this focal. Focal means small portion of the brain there is abnormality. The focal seizure. This is generalized. This is generalized. Number 2, generalized seizure. This attack occurs when the whole of brain tissue works abnormally. It may be of 6 types. Number A, absent seizure, affects children mostly. Subject lose consciousness for a few moments, look vacantly, blink eyes or smack with lips. B, tonic seizure. In this type, muscles get stiff, especially that of back and limb. Subjects faint, fall down on floor. Atonic seizure. In this type, subject lose control over muscles and fall down on the floor, collapsed. D, clonic seizure. In this type, subject exhibit rhythmic spasms again and again in muscles of neck, face, hands. Number E, myoclonic seizure. Muscle of hands and legs show sudden short spasms. B, F, tonic-clonic seizure. This is commonly known as epilepsy. This is the most general form of epilepsy. Subject lose complete sense, whole body gets hard and violent spasm starts, pass urine unconsciously, bite lips, etc. This is the most common type of seizure. When to consult a doctor? Number 1, when first attack occurs. Number 2, in case of diabetic and pregnant ladies. Number 3, if second attack occurs before first attack settles. Number 4, if after finish of seizure, sense of normal respiration. Sense of normal respiration does not return or establish. If there is high fever, if during seizure subject hurts self badly, if seizure continues for more than 5 minutes. What is the reason of epilepsy? No reason is found in 50% of cases. In the rest, following different reasons are elicited. Number 1, genetic effect. Number 2, brain injury. Number 3, brain stroke or tumor. Number 4, infectious diseases like meningitis, viral encephalitis, etc. Number 5, prenatal injury. Number 6, problems in development stage of children like autism, neurofibromatosis, and lastly, dementia. Now, the remedies. Argentum nitricum for epilepsy. For days or hours before attack, the pupils are dilated. After attack, patients restless, their heads tremble. Epilepsy from fright during menstruation at night, followed by debility or for several days. Gloomy, dull, sit completely idle for fear of an attack. Now, causticum for epilepsy. Hysteroepilepsy at the age of puberty or related with menstrual irregularities. Convulsions with screams, gnashing of teeth and violent movement of limbs. Involuntary urination after fright or suppression of eruptions. Worse during new moon, better from drinking cold water. Calcary arts for epilepsy. Epilepsy from cardiac affections, starting with a pain in heart, rush of blood to the head, loss of speech, unconsciousness. More in daytime, better on lying down, bodily and mentally relaxation. Agaricus for epilepsy. Attack from fright, from suppressed eruptions. Attack every 7 days. Fall and lie motionless, as if drunken and always feel sleepy, unconscious, speechless with convulsions, face blue and puffed, froth at mouth, aura. Aura means special sense or special feeling just before attack. This is called aura. Sensation as if cold air were spreading from spine over the body. That is, the patient of agaricus feels this, that something cold air is spreading from his or her spine over the body. Thereafter attack comes. So this is aura. Ammonium cart for epilepsy. Epileptic spasms from virulent or violent, same thing, cerebral irritation. Subject hysteric. They feel as if head would burst with sense of oppressive fullness. Worse after eating. While walking in open space, better feeling from pressure. In warm room, subjects take cold easily, unclean in habits, prostrated from trifles, tend to lie down. Gelsemium for epilepsy. Hysterical epilepsy after suppressed menses, preceded by fullness and pain in the neck with dull feeling in head. Subject always feel dizzy, drowsy. They feel worse when thinking of their illness, feel better reclining with head held high. Opium for epilepsy. Epileptic fit from fright. Attack mostly nocturnal with continued stertorous breathing. Stertorous breathing means very much noisy breathing, which is deep and unequal. Face cyanotic, red, bloated, distorted. Sleep deep, comatose. Coma means deep unconsciousness. Suffocative paroxysm during convulsive state. Nitric acid for epilepsy. Epileptic spasm after midnight. Tongue beaten, snoring during sleep. Mouth and head drawn to and fro. Excessive irritability with debility after attack. Aura begins in left arm. Some aura start from the left arm. Maybe it is just tremble, some different type of pain, something that is. Not in all cases aura is received, but in some cases there is aura is received, and if this aura is received, I mean it felt, then it's a very good sign for treatment. Tarantula hispanica for epilepsy. Hysterical epilepsy. Before onset of fit, dizziness, convulsions with precordial anguish. Precordial means heart area. Staphysagria for epilepsy. Emotional epilepsy from bad effects of masturbation or excessive sexual indulgence. Chronic cases. Great sensitiveness of mind, nervous system. Vertigo, anxiety with fearfulness. With this, the video ends. Thanks for listening, viewing. If you got any difficulty, please write down in the comment section. I will certainly respond.